Even though more than half of all Texans are now fully vaccinated against COVID-19, cases and hospitalizations are rising quickly here in Texas. Joining us now to discuss is Dr. Natasha Kathuria, an emergency room physician right here in Austin. Doctor, thanks for the time today.
Thank you for having me. Happy to be here.
Well, we just heard the governor say that the days of mask mandates in Texas are over. Now, with the Delta variant spreading, is masking still a good idea, especially for those unvaccinated indoors?
Yes, so we are teetering on level 4 with this pandemic. And what that means is once we cross into level 4, we go back to recommending masks for everyone, regardless of your vaccine status. And we're right there. So at this time, for anyone who's indoors in any crowded areas, it's the safest thing to do to just go ahead and wear a mask, even if you're vaccinated.
You all in our area hospitals have been through this for a long time now. What's morale like? I know we had a dip in numbers and everybody felt good. Now the numbers seem to be going back up and you all are working even harder. What's morale like now?
Morale is struggling a little bit. You know, we've gone through quite a few surges now in Texas and in the Austin area, and we never thought we would get back to this level this soon, especially with vaccines and, really having an answer. And unfortunately, we're really struggling to get enough people vaccinated. So morale's not super high in the hospital right now. We've had our hospitalizations rise dramatically, as well as our ICU admissions. And it's starting to look like exponential growth, which is what we get worried about with the surge. And the fact that we would be facing another surge when we have vaccines so readily available for anyone 12 and older is really quite astonishing and a little disheartening, to be honest. But we're pushing through. We are fighting with extreme nursing shortages throughout the state, especially in Austin, Travis County. So we're doing our best to make do with what we have right now and take care of our patients.
It appears that the Delta variant is what we're seeing primarily, at least what you all are seeing primarily now. Are you seeing that affecting younger and younger people now? Is that something that concerns you?
It's definitely something that concerns us. We are seeing a higher proportion of our patients with COVID being younger than ever before. And there's lots of things to take into consideration there, right? The majority of our elderly are vaccinated now. They took the vaccine very seriously, our elderly population, and rightfully so, they're most at risk. And so our younger patients are the ones who are mostly unvaccinated. So naturally, if they get COVID, they're more likely to fall ill. But also the variant itself is more contagious and more dangerous. So we've seen even in other countries that have lower vaccine rates that it is more transmissible and infectious among the young than it was before.
Dr. Kathuria, thank you so much for your time. We really appreciate you joining us here on KVUE.